Okay, this is a follow-up from the total knee replacement swelling issues I was having earlier, at approximately a year and maybe 3 months from my last video. So, I think my last video I was maybe at 9 or 10 weeks, and I was having these big swelling events. My knee would get completely engorged with blood and fluid or whatever it was, and I would be incapacitated for 8 hours. I couldn't move. I'd have to use a walker. And Hope Orthopedics, who did my surgery, Dr. Zirschky, basically, they said, you're just a sweller, this is what it is. Some people are swellers. And at 12 weeks, I got the letter that said, well, we won't be able to take care of you anymore. Your insurance won't cover any more appointments this year, because I was having a problem. And they I was sending them letters through the patient portal. It happened again. This is what's happened. This is what I'm taking for it. This is what, just so they, thinking that they would be interested in wanting to know. But no, I never got a response from that. And then on my final 12-week appointment, they said, you know what, you're just a sweller. And they said it's going to get worse. They said it's going to get worse because everybody stops doing their exercises, and it always gets worse when people stop doing their exercises. And Courtney, Courtney was the physician's assistant, and I can see the shadow in her eyes, that look of pity, that this poor thing, you can just tell and see what that is, and anyhow, I took another job, and I was no longer in the system to where they would take that insurance, so, which is just fine. They obviously weren't going to stand by it anyway. So I got into the Kaiser Permanente system, and at about 6 months, I'm on a cane now, full time on a cane. I can't walk without a cane, or else it's going to trigger a swell event. And I finally went in and said, this is ridiculous. Yes, I was told it was going to get worse, and it did. But not because I didn't do my exercises, because I couldn't do my exercises. It got to the point that any leg lift would cause a knee swelling event. Any exercise I did at all would do it. So went to the doctor, Kaiser Permanente. She sent me off to the specialist for knees. He took the x-rays. He said, kiddo, you need to go to the revisionist right now. And they sent me over to the revisionist. And 11 months later, from my first knee replacement, I had a knee revision surgery. So this knee seems to be holding me pretty well, and I don't have any swell events with it. But during that surgery, I picked up staph bacteria in my knee. And the night that I came home from surgery, I had to go right back to the hospital, and I spent 5 days there while they cultivated the cultures to see which strain of bacteria was in my knee. It wound up being staph. One was a lung-borne staph, one was a skin-borne staph, and they had to mix up a special concoction of antibiotics for me, and I wound up being on 3 months on the IV antibiotics, which has its own pain in the neck thing about that. Look that up one day. And then I had to have another 3 months of oral antibiotics after that. So I am now antibiotic free, and I'm hoping that I will continue to, I'm hoping they got it all. They did, an infection did not have time to really set in, which is great. So hopefully it didn't get attached to my prosthetic knee, because that's what happens with blood bacteria. It actually holds on to the knee, and you can cleanse the blood, but it can hide in the crannies of your new knee, and then it can grow later down the line and get sitting there and simmer for eons. Then you have a failed knee again. So I can't go get another knee replacement because I have a big giant 3-inch spikes in both sides of my legs. This new knee is not like the first one, and it's in there to stay. And I just pray I don't have to have anything else down the line in short order. But this is my update, my word of advice. If you are thinking about having a knee replacement surgery, don't do it. Lose your weight, do stem cells, CBD, anything. don't get rid of your natural knee unless you are crippled and you cannot walk at all. Use a cane. The cane can be your best friend. The cane was wonderful. Using the cane when the knee revision started acting up. If I would have realized how great a cane was, I could have done so much more, before my surgery. I could have had a halfway, I could have done stuff. I could have gone hiking. I could have done all kinds of things with the cane. It really helps in taking the weight off of that bad knee. So get okay with the cane. And until science comes along and is able to save your knee and do other things, but don't let them take your knee. Once it's gone, it's gone. If I have to have another replacement, and let's say it's glued in there really well, and they don't get it out and they shatter my leg, guess what? I don't get to have a leg anymore. So the risks are real in this. The risks are real. And they don't tell you these risks when you go into the doctor's office. And even when you're researching this stuff, you're not researching it the right way before you have a knee replacement. You really need to Google, my knee replacement failed, and look at those stories, not what are the risks of a knee replacement. Things like, my knee replacement failed. Then you get a whole new slew of other things that come up. Okay, that's the sad update of that, and I hope anybody who's listening to this, I'm just wishing you the best, because if you're listening to this, it means you're having some problems with your knee. If anybody has any questions, you can certainly, email me under there. I think there's a place for that, and I've been through a lot, and I can probably help you out a little bit. Okay.